on the combination of olaparib and cediranib in recurrent ovarian cancer.
Thank you very much. On behalf of my co-investigators, it's my pleasure to discuss the results of our randomized phase 2 trial comparing the efficacy of the combination of the PARP inhibitor olaparib and the anti-angiogenic cediranib in women with recurrent platinum-sensitive ovarian cancer. Olaparib is an orally bioavailable PARP inhibitor with demonstrated activity in recurrent epithelial ovarian cancer. Similarly, cediranib is an oral anti-angiogenic agent that is also active in this disease. Preclinical studies have suggested that PARP inhibitors and anti-angiogenic agents may work synergistically in ovarian cancer. We therefore started this phase 2 trial, which compared the activity of the combination of cediranib and olaparib to olaparib alone in recurrent platinum-sensitive ovarian, fallopian tube, or primary peritoneal cancer. The study was designed as a randomized, multi-center, open-label phase 2 study. In total, 90 patients were accrued at 9 separate treatment centers. Key eligibility criteria included platinum-sensitive, relapsed ovarian, fallopian tube, or primary peritoneal cancer, where the cancer had recurred at least 6 months after the last receipt of platinum-based chemotherapy. All patients were required to have high-grade serous or endometrioid histological subtypes, although other high-grade histological subtypes were allowed if the patient had a known prior germline BRCA mutation. Of note, the randomization was stratified for BRCA mutation status. Below is a schema of the trial design. As I have mentioned, it was randomized 1-to-1 between the 2 arms of olaparib capsules at 400 milligrams twice daily, or previously established phase 2 dosing of cediranib and olaparib, with cediranib at 30 milligrams daily and olaparib at 200 milligrams twice daily. All patients continued on treatment until they had evidence of disease progression by radiographic imaging. The primary endpoint of this trial was progression-free survival. We found that the cediranib and olaparib combination significantly increased progression-free survival as compared to olaparib alone. This figure shows the Kaplan-Meier survival curves of both arms of the study, with the cediranib and olaparib in red and the olaparib alone in blue. As can be seen, the median progression-free survival was increased with the combination from 9.0 months on olaparib alone to 17.7 months on the combination of cediranib and olaparib. This 8.7-month increase was highly statistically significant, with a p-value of 0.005 and a hazard ratio of 0.42. Prior studies have suggested that women with BRCA mutations may have increased sensitivity to PARP inhibitors. We looked at the activity of the cediranib-olaparib combination in both patients with and without a known BRCA mutation. As can be seen in this slide, in patients with a BRCA mutation, there was a trend towards increased activity of the cediranib-olaparib combination, with a median progression-free survival going from 16.5 months in the single-agent arm to 19.4 months in the combination, with a p-value of 0.16. However, in patients without a mutation or whose BRCA status was unknown, this difference was much more marked, with an increase in progression-free survival from 5.7 months on olaparib alone to 16.5 months on the combination of cediranib and olaparib, with a p-value of 0.008. In conclusion, this is the first study to explore the activity of the combination of a PARP inhibitor and an anti-angiogenic together in ovarian cancer. The combination of cediranib and olaparib was more active than olaparib alone and improved progression-free survival from 9.0 months on the single-agent arm to 17.7 months on the combination. The observed activity on the combination arm compares favorably to what is seen with standard of care chemotherapy in this setting. Of note, activity of the combination was observed in both BRCA mutation carriers and non-carriers, as well as those in patients whose BRCA status was unknown. The toxicity profile of the cediranib-olaparib combination was acceptable. The most common toxicities we observed were those of hypertension, diarrhea, and fatigue, which were overall manageable with aggressive symptom management and dose holds and reductions. The degree of activity that we were observed with this combination supports additional clinical evaluation of cediranib and olaparib together in ovarian cancer. Thank you very much.